Hi, I'm Dr. Kirsty Cunningham, a board-certified OBGYN and certified menopause physician. I help menopausal women achieve their best health. I'm going to talk to you about a very serious problem that plagues millions of women and men, and that is dementia. In a recent report released by the Alzheimer's Association, it's estimated that nearly 7 million Americans are living with Alzheimer's, which is the most common cause of dementia. And this number is expected to increase to 14 million by 2060. To better put this in perspective, here are a few more facts released by Alzheimer's Association. 1 in 3 older adults dies with Alzheimer's or another cause of dementia. Dementia kills more people than breast cancer and prostate cancer combined. Between 2000 and 2021, deaths from heart disease have decreased by 2.1%, while deaths from Alzheimer's disease have increased by 141%. The lifetime risk for Alzheimer's at age 45 is 1 in 10 for men and 1 in 5 for women. There is currently no cure for Alzheimer's. There are drugs which change the biology of Alzheimer's and decrease the rate of cognitive decline, but they have common side effects such as other brain changes, headaches, and falls. Other drugs address the cognitive and behavioral symptoms associated with Alzheimer's, but don't slow the progression of the disease. Non-drug treatment includes physical activity, memory exercises, and music therapy, but again, these treatments don't slow the progression of the disease. Most persons that develop Alzheimer's are age 65 or older. Experts feel that Alzheimer's develops as a result of multiple factors, not just a single cause. The major risk factors include age, genetics, and family history. Their greatest risk factor is age, with the percentage of persons with Alzheimer's being 5% at age 65 and increasing to 33% by age 85. There are at least 33 genes that increase the risk of Alzheimer's. The gene with the highest risk is the E4 form of the apolipoprotein E gene. For persons aged 60 to 65, the risk of developing Alzheimer's with 2 copies of this gene increases up to 40%. Family history plays a role in the risk of Alzheimer's. With the more first-degree relatives with Alzheimer's, the higher your risk of developing Alzheimer's. Another risk for dementia in women is the loss of estrogen, which occurs in the menopause transition, putting women at twice the risk compared to men. There is increasing evidence that shows that the estrogen receptors in the brain play a role in the pathogenesis of Alzheimer's disease. Although you can't change your age, genetics, or family history, there are some modifiable risk factors. The Lancet Commission on Dementia Prevention has suggested that approximately 40% of cases of dementia are related to modifiable risk factors. These include physical activity, diet, smoking, and education. A recent study showed that eating processed red meat increased the risk of dementia by 14%. The same study showed that swapping out one of these red meat servings for a serving of nuts or legumes may lower the risk of dementia by 20%. Other than lifestyle modifications, there is one other thing you can do to reduce your risk of dementia, and that is estrogen replacement therapy. Estrogen therapy is currently the only modality we have that can help prevent dementia. Estrogen is neuroprotective and also anti-inflammatory, thus preventing cognitive decline. Estrogen replacement therapy also has other benefits, such as decreasing cardiovascular risk, decreasing the risk of osteoporosis, decreasing insulin resistance, plus fixing hot flashes and vaginal dryness. Estrogen does not cause breast cancer. In fact, there are several safe forms of vaginal estrogen for breast cancer patients. If you or someone you love could benefit from estrogen replacement therapy, please contact us.